So I often get asked when women are looking at implant-based reconstruction whether or not to go with a silicone implant or a saline implant. I think the first important thing to recognize is that both implants have a silicone outer shell that is the direct interface between implant and your natural tissue. The main difference is a saline implant is an empty envelope of silicone that you then fill up with saline versus a silicone implant, which is filled with a form-stable gel. Often patients worry that the silicone implant, if you're going to cut into it, you have this liquid that just oozes out and fills an entire pocket. Whereas this was true with the earlier generation implants, this is no longer the case. And you can see that if you were to undergo an implant rupture, which is often just a small hole on one aspect of the implant once they've been in place for over 10 years, you'll only have a small amount of silicone leakage through that spot. For a cosmetic augmentation, both silicone and saline are good options because you have your entire breast gland that's covering that implant. In a reconstructive setting, you've lost your breast gland and you only have that really thin envelope that's covering the implant. So if you have a saline implant in, it can feel and look a lot less natural, kind of like a water balloon type picture. And you can have a lot more implant visibility. So this is a gel implant, but just to demonstrate rippling, these are these lines that can be seen a lot more commonly with the saline type reconstruction versus a form-stable silicone implant that really holds its shape well underneath that thin envelope of skin, giving it a much more natural appearance and natural feel. So my recommendation is for breast reconstruction with a very thin skin envelope, go with a silicone implant.